This is the Lowdown with Bravemumma, a community to see you, hear you, and support you on your journey living with pelvic organ prolapse. Hi there, it is your host, Steph Thompson here, and just before I introduce our guest for today, I have something beyond exciting to share with you. Our beautiful podcast partners, the Empowered Motherhood Program, as you would have already heard, have been offering our Brave Mummahood 10% off for the lifetime of their membership using their app that has specific prolapse, prenatal, postnatal exercise for you. I'm going to put a link in the show notes. If you are already part of our mailing list, it'll be sent to you directly to check it out, but it's amazing. Up to 45% off your membership. Now that is something that is really hard to pass up. So our guest today is continuing our conversations around Caesarean Awareness Month, which was April. Now, the fact that we're sharing this with you in May, there's actually a point to it. And that is, while it's beautiful to have these awareness months and awareness days to start a conversation, we also think it's just as important to continue the conversation. Today, I have invited Leonie Rastas, who is known as the C-section whisperer, and her background in midwifery, having 6 children of her own via Caesarean section, really puts her in a place to be an expert to talk to us today about all things Caesarean section, birth and recovery. So let's get into our chat with Leonie today. Leonie, thank you so much for joining us today for April Caesarean Section Awareness Month. I want to start by saying I know this conversation, we're sharing it after April, but isn't it really important that even though we have awareness days and awareness months, they're good to start the conversation? But do you think really we need to continue these conversations because it's not just a one-off, right?
Absolutely. And especially with this rise in caesarean rate, we really do need to be keeping it out there and helping women and how to prevent complications and have the best possible recovery. So yeah, that's a 365-day job.
Yes, I love that you said that, 365 days, because women are having babies 365 days of the year. Now, what I've actually done is I've put a link in the show notes to your story that you were just recently featured in Mamma Mia, so congratulations. And that kind of goes into great depth of what happened. I was wondering if you could just give us an abbreviated version of that. I mean, you've had 6 children, and so maybe let's just talk about the birth in particular that really drove you to write a book, to create a device and a Facebook community for women going through caesarean section to support them before birth and after birth.
Okay. Well, it was established with my first baby that I would have to have caesarean births because of the X-ray pelvimetry that was done in the 80s. And so I did have 6 caesarean births. 5 of them were epidural, and of those 4 epidural or spinal anesthetics, and of those 5, 4 were fantastic. They were just wonderful. However, the 5th one was problematic. What happened was I engaged a senior anaesthetist, a consultant, to do my 5th spinal, and he was quite happy with that. He said, yeah, he would do it. However, on the day I went in to have my baby, he didn't turn up. There was another substitute. A younger guy was sent to do the anaesthetic. And it appeared to have worked. However, once the obstetrician started cutting, I could feel the scalpel. I could feel everything that was happening. Unfortunately, there was no help available. The doctors said they needed to continue what they were doing, and the anaesthetist just looked lost. He didn't have anything to offer. I wasn't offered a general anaesthetic, which really should happen if you're feeling the pain. So basically, I just had to endure the surgery and the stitching. And being a midwife myself, I knew where they were up to and how much longer I had to go. So I basically just realised I was on my own. I wasn't getting any help from within the theatre. So I just went into a deep meditation and prayed. And that was really how I got through.
Okay, I've got a few questions on that. If you don't mind, if we just go back a second, because yes, you've mentioned, and I did introduce you in the intro as a midwife. So you have a wealth of experience in childbirth, both vaginal and caesarean births.
Yes.
My first question would be, back in the 80s when you had the scanning of your pelvis as a midwife, and then were you told your pelvis was too small? Like, what was
Yes.
the result of that? Okay.
It's called CPD, contracted pelvis diameter. Yeah.
Okay. Do they still do that these days? Because I tell you why, I feel like
No.
I see in social media a lot, especially from the natural birth advocates.
Mm-hmm.
Don't let anyone tell you that your pelvis is too small.
Mm-hmm.
So what has been the shift there?
Well, I guess the risks outweigh the benefits, and they just don't offer X-ray anymore. So,
Oh.
yeah, I think that it's just women are left to just trial and error, and then we have what they call obstructed labour.
Mm,
So a woman can be in labour for 20 hours and then there's no progress, so she'll have an emergency caesarean. And
okay.
that's sort of where we're left. Every woman pelvis is I guess deemed capable of
Okay.
birthing a baby until it doesn't,
Right.
and
Interesting.
yeah, that seems to be the case given the benefit of the doubt.
Yeah, right. That's thank you for sharing that because I didn't know that education piece. Now, the second question was when you were there on the table in your full vulnerability in theater and you had this and I don't know, it just always feels like it's always the way. Like I booked this obstetrician, but he couldn't make it or it couldn't happen. So I had someone else. And it's the someone else where a lot of
Mhm.
the things seem to
Yeah.
not go to plan, right?
Yes.
So you were there in full vulnerability. When you said you couldn't get help, I'm just thinking of the situation you were in. What could you possibly ask for? How do you advocate for yourself to
Well,
ask for anything? Like, what could you have asked for?
what I realise now was I don't recall a conversation with any anaesthetist about what if it doesn't work? What will you
Okay.
do? And so, I really encourage women now to have that conversation. Will you believe me if I say I feel it? Will you
Okay.
take action? Will you give me a general anaesthetic? I'm okay with a general anaesthetic. I would rather, not see my baby straight away than
Mm,
endure that torture, really. I mean,
yeah.
I dug holes in my husband's hand and he told the doctors I could feel it. The two nurses told the doctors and they said, we've got a job to do. We have to go on. And
We've
that's
got
where
a
I
job
slept.
to do. We've got a
Well,
job to do. Isn't the
they,
job to protect the mum and
well,
the baby?
I could see that, I don't know, they weren't pretty intent on continuing. So I worked that out and I realised that I don't know if the anaesthetist topped up my epidural or spinal. I don't know that. I
Sure.
don't recall a conversation with him at all, but I do remember his face looking
Yeah.
totally bewildered. Really
Do.
sorry for him actually later, thinking
Oh,
that, he'd been left to do this or sent to do this without his supervisor. Yeah, so it was just a really unfortunate situation. But the good thing is that it has been the catalyst for me writing this book. And the research that I've found since is that anaesthetists caution to have that conversation or mandated to have that conversation and be prepared to switch to a general if necessary. The guidelines from the UK talk about believing the woman. If a woman says she's feeling it,
yeah.
believe it, take action.
Yes.
And, so that's really good to know.
So is that happening here in Australia now too, or just in the UK?
Well, I couldn't find any guidelines in Australia, but the UK one came up, and that was written by a consultant anaesthetist who had worked at the University of Nottingham, I
Okay.
think, and he had been called to give an opinion on 74 cases of failed anaesthetic.
Oh,
And
so it's not rare.
no,
Oh,
not
okay.
at all.
Wow. Okay.
Yes, so he said that the reason that it's the most successful or the commonest successful litigation against anaesthetists is for failed anaesthetics. And he said that, then he was encouraging, believe the woman,
Mm.
take action.
So when you go to have a cesarean section birth for the first time, if you know you're having a planned Caesar, is an obstetrician meant to kind of explain to you the process from start to finish, risks, benefits, and do you sign a paper to say that you understand that?
Yes,
Okay.
that's right.
So your obstetrician during that birth, or the doctors during that birth, are you saying you didn't recall having that conversation or anything like that?
Well, look, I can't, to be honest, but
Yeah,
being a midwife, they probably thought that they could skip that I'd know it
agreed.
all.
I was thinking the same thing. They
Yeah,
probably just
yeah,
assumed
yeah,
she knows what she's doing. We don't have to go through this. Isn't
yes,
it interesting? I
yeah.
have a question around litigation because it is back in the 80s. It was probably very different then to what it is now. Did you kind of seek your medical notes and find out what they recorded happened in that room?
No, and unfortunately, I did. I was very unwell afterwards. So I think it was about the
Yeah.
3-month mark that I developed an abscess in my tooth, and the dentist tried to numb my gum, and I couldn't accept the anaesthetic. She tried everything, and
Oh,
she said, "Look, come back tomorrow," and still couldn't do it. So I ended up seeing a GP who practiced hypnosis, and she confirmed that my rejection of the anaesthetic would be related to my
God.
experience. And I had 2 sessions where I got to reframe the pain in theatre, and then I went back to the dentist, and first injection I was numb, so that was really
Wow.
good. And then, she said to me, "Look, if you need emergency surgery between now and when we finish this therapy, you're going to need me to come to theatre to help talk you down into the anaesthetic," which was a
Okay.
little bit frightening.
Of
But
course.
anyway, she was amazing, and that was solved pretty quickly. And then soon after that, I read an article about a woman who had a failed anaesthetic. She said it was like a hot knife cutting through butter. Oh, and I had kept the lid on it until then, and
Okay.
then I just went into PTSD symptoms, and my life was in chaos, really. I had, couldn't sleep. I was hypervigilant, having flashbacks. I was confused. My memory was gone. I was so anxious. I thought one of the children, they all had asthma. And I thought one of them, which actually often they're finding can go with caesarean births. A lot of
Oh,
children
yeah.
born by caesarean have asthma. So I had the jackpot. I had 5 with asthma, and I used to panic that maybe they'd have an asthma attack at night. And so I'd be like Florence Nightingale going around checking their breathing, and then they were okay. So I decided, my husband, I'll keep an eye on him. So I was taking his pulse at night because
Oh,
his
you were
father had had a
not.
heart attack. And I thought, oh, so it was just totally chaos. And my
Okay.
husband actually spoke to a lawyer about the negligence,
Okay.
and he advised him that it would be too traumatizing
For you.
to revisit. And so I didn't bother. And it wasn't until after I'd written the book and
Mhm.
finished, I thought I would really like to know what happened to me, because what happened after the book was the research is sort of appearing about birth trauma and
Yes.
obstetric violence. And I
Yes.
thought, I've got a name for what happened to me. I didn't have a name for it until then. So I
Wow.
thought, I must try and get my records. So I phoned the
Okay.
hospital,
Yes.
and only to find that they had destroyed them. So
Oh, because it was a period of limitation of
yeah.
time.
Well, I think she said they kept them for 15 years, and so it's over 30 years since that
Wow.
happened. So, yeah, that's really disappointing, but, I just sort of took me a couple of probably 18 months to level, and, yeah, it was a really, really tough time.
I bet. Thank you for sharing that vulnerability with us, because it's even as a midwife to go through that yourself is it's very full on. And in
Yeah.
actual fact, I don't believe even if you did receive your notes that those doctors would have actually said what was your experience. They would have put down what they wanted the experience to be, because it's handwritten. It wasn't a digital
Yes.
footprint. And I say that because I know my notes from my birth trauma were vague at the best, not even written by the person who helped deliver the baby, the person who was
Mhm.
responsible for the vacuum forceps. She didn't write one note.
Mm,
They were written in retrospect by the midwife, who was not even at the point of the birth. She was at my face.
mm.
So it may not have actually given you a resolve anyway, Leonie, if that's a little bit of comfort for you. And I just love that what you're doing now is actually taking a really shitty situation and having to go through that and live in silence and live with this thing
Yeah.
you didn't even know what it was called, to recognize it, seek treatment and help, to
Mhm.
come through the other side, specifically to help other mums. Let's talk about that a little bit more, should we?
Yeah, well, I was acutely aware of the pain that you feel after a cesarean around the wound, and the limitations, and any sudden movement
Mm,
is really difficult. Any coughing or sneezing or even laughing.
mm.
And one of the things I learned in my nursing course was, for any abdominal surgery, always roll up a towel or a
Oh,
cushion to
yes.
support during those sudden movements. And I don't know where it's been lost, but I would often go to work and I might be allocated 3 cesareans and none of them had the towel or the towel or the cushion. And so that was always my first job. I would go and get the towels, tape them up, educate the women how to use them and to keep them nearby, and and used to introduce it as their best friend, for the next week, to don't be separated from the towel.
Yep.
Anyway, one day while I was making this towel, a dad said to me, "What are you doing?" And I explained, and he said, "Don't you have something in the storeroom fit for purpose?" And I said,
In the
"No,
storeroom.
I've been doing this for 40 years." So I thought about that and I thought, I
Mm.
wonder, is there anything? And I checked the internet and I couldn't see anything. There was something vaguely like it in the UK for £100. It was 150 or something. And I
Yeah.
thought, no, surely there's something around. And when I couldn't find anything, I set about designing my own. And
Yeah.
I called it the SAC splint, or surgical aftercare splint. And a lot of women have used them and said they've been really helpful.
Yeah.
And so that was the beginning. And then I realized, actually, it's very hard to get that message across. I think I need to create more education. So that's when I set up my Caesar Care to
The
help with
website.
programs and online programs. And then I that morphed into a care package. And
Mm-hmm.
then I was invited to London to the International Maternity Expo to
Okay.
show my splint.
Yes.
And there I met a midwife who shared the same concerns from the UK, and we decided to put our heads together
Mm-hmm.
and write a book, a
Wonderful.
manual, a C-section recovery manual. So we
Yes.
did that during COVID via
Okay.
Zoom with
That's
the time
amazing.
difference. It was a nightmare. And we've created this amazing book. And I say to mums, it's sort of a little bit like the baby book, but it's the mum book.
Oh, like the
And
blue book, you mean? The one that the baby gets and takes home. This
oh
is one
no,
for the mum.
the milestones books. You can get all sorts of books to
Oh,
keep
yes.
baby records.
Yes.
Well, with this, we've got 12 chapters of knowledge about, recovery and
Mm-hmm.
sleeping and feeding positions and things like that.
Oh,
And
okay.
then we've got the middle section has journal pages. So we've got a little bit about the importance of maternal journaling, and then the blank pages with prompts. And then the third section is 6 weeks of day planners, so that they can just,
Oh,
in the fog and the tiredness, the fog of the pain
yes.
relief and all of that, they can just open the book and go, "Oh, I haven't had my lunch, or I haven't had my breakfast," and
Step
things
by
like
step.
that. And then there is also a scar tracker, which I designed. So it's got the signs of normal wound healing and
Okay.
abnormal, and
Great.
encouraging them for 30 days, because you can get a wound breakdown or infection up to 30 days after
Okay.
surgery.
Yes.
So this is just to keep them on track and to know when to seek a medical review. So that was sort of, yeah, like I just felt that I wanted to share
Yeah.
what I'd learned along the way, and also a companion for the women, because so many are going home after 24 hours
Mm.
and it's, oh, what next? So this
Yeah.
book goes through all of the stages and the weeks afterwards.
That's amazing. And I think a lot of women just get that 6-week checkup back to life. Okay, I can go back. But then, as you say, it's really hard to know if a wound is looking like it's healing, because sometimes you might get a little bit of pus or something, but it's part of the healing. And other times
Mm.
it's the breakdown. I had 2 midwives look at my stitching and from the episiotomy who said, it's fine. And then when I'm like, I don't think it's fine, but I'm not the expert, they just said, well, just go to the GP. And when I did that, he's like, you are going straight back to hospital. That is so infected. It's ridiculous.
Mm.
For my obstetrician to look at it and say, yeah, we're going to have to start this all over again,
Mhm.
and had to take action. So I think it's important, even if you do have a good support network, if in your gut you're feeling like it's not feeling right or it's a smell, and I'm guessing that your book walks them through that. If
Ab Yes, absolutely, because and we tell a story of a midwife in the UK who felt things weren't right and kept going back to the doctor, and they said, "Oh, it's probably mastitis, just take these antibiotics." And she ended up having sepsis and had to have a bilateral amputation below the knees.
what?
Yeah, because
Oh
it
my gosh,
wasn't detected. So these are the
Leonie.
things that we've got in the book that, it's not good enough to say, go home and see your doctor in 6 weeks. It's important that the women look at their wound every day with a handheld mirror or a full length mirror, or
Yes.
get someone who can and keep to monitor it daily. And there's also women who feel they don't want to look at it. They feel yuck about the scar.
Yeah, I
So
get that.
we want to encourage them to, if they can, to befriend the scar and see it as a positive thing,
Mm-hmm.
because the stigma that goes with cesareans, particularly emergency cesareans, a lot of
Agreed.
women feel they've really failed. In a way, maybe it was a bit of an advantage having that X-ray pelvimetry at the outset. Like I was never allowed to try because I'm
Okay.
only 5 foot tall,
Okay.
and
Yeah.
I was probably, but at the same time, I for a long time felt robbed that I'd never had that
Childbirth.
triumphant last push that
Yeah.
vaginal birth gives. And I struggled with that for a while, but now
Okay.
I sort of think, actually, it's an enormous triumph to push a baby out of your body. I know that. But it's also an enormous triumph to have major surgery while you're fully awake.
Oh,
So I think that both have, you know, triumph at the end, and we should really encourage women to see that it's not a failure,
yeah.
and once a C-section isn't always a C-section. There's wonderful research out there now about vaginal birth after cesarean. I
That's right.
really encourage that.
Mm.
It really depends on the reason for the cesarean.
Yes.
If it was because the baby was in trouble, well, then that may not happen for the next one. It
Mm.
may be okay. And
Yes.
there has been quite a surge in vaginal birth after cesarean section, which is really good.
Y-
So there's a lot more
Yes.
support and knowledge about that now.
And I love that you say that a VBAC is a choice. Like, just because your first birth went a particular way doesn't mean the second one has to have that
Mm.
same outcome. And I love that we're sharing these stories in the hope that women feel more empowered. And I want to address the fear factor, because obviously when our listeners go and read your story in Mamma Mia, and I've looked at the comments, and so many women say thank you because I felt so alone. Now, I also know, especially in social media, Leonie, I don't know how it kind of fits in the midwifery industry itself, that we don't want to tell women too much about childbirth. We just want to give them all of the lovely, fluffy stuff. We
Mhm.
don't want to tell them anything because we don't want to scare them. However, I can guarantee right now that you were scared even though you were not told. I was scared even though I was not told. I feel like by keeping it a secret, we're not eliminating the fear. In fact, we're probably just making it worse,
Mm.
right?
Yeah, absolutely.
So by telling these stories, and I don't know if you've ever heard, stop telling women horror stories in
Yes.
childbirth. And I have a lovely comeback for that. I'd love to share it with you. I say, stop calling them horror stories, because when we do that, we imply that they're made up or exaggerated.
Mm.
They're horrific, yes, but don't tell me that I have a horror story, because I'm not trying to scare women, and neither are you, by creating this book and this splint and then this free Facebook community to help women not feel alone. It's not to scare them away from vaginal birth. You've said it just there, a
Mm.
VBAC, right? You're not in either camp, cesarean or vaginal
Yes.
birth. You just want women to be able to have the information to say for themselves, actually, doc, I want to talk about a VBAC some more, right?
Yes.
Or I want to choose a cesarean, full stop, end of conversation, and not feel ashamed and not have the taboo. I just really would love to birth my baby via cesarean section. Thank you.
Yes. Yeah, and they shouldn't have to explain, because we know a significant number of women have been victims of abuse,
Yeah.
and maybe just the thought of, being in that position, it would be a trigger, and they just need to avoid that at all costs. So we really have no right to really challenge, I don't think. Women shouldn't have to justify their choice. And maternal
Yes.
choice is a lot more accepted now. Yeah, that is important, I think.
Yes. And I think women can only have and make that choice when I say they have both sides of the textbook. So they have all the information about vaginal births, risks, benefits for them individually.
Yes.
Cesarean section, risks, benefits individually for them and their body.
Things are changing in that area. And there's Hazel Keedle's done a lot of work on vaginal birth after cesarean, and that's quite amazing, the amount of women who are able to, and she has a really good strategy. And when they're finding women who are cared for in midwifery group practice by a known midwife have a better chance of a vaginal birth success after cesarean as well. So there's a lot of different models of care now which are really helpful in empowering women. So,
Yes.
yeah.
And midwifery-led practice was very much on trend when I had Elsie 7 years ago, and that's exactly how I was in that program to start with. So I've had both experience, midwifery-led care and a private obstetrician, and having the privilege of being able to have the choice.
Mhm.
Now, there's no point me saying which one I prefer, because it doesn't matter.
No.
I think every woman has to be able to have that experience of, like, my wish,
Yeah.
Leonie,
Yeah.
is for someone to have access points throughout the entire 9-month pregnancy from speaking to doulas, midwives, obstetricians, anesthetists, counselors, the whole gamut,
Yes.
before getting into the moment when this baby is coming out one way or another.
Yeah.
Let's make those decisions and those thoughts and those conversations and those hard questions before
Yes.
the moment, so that you can work through any fear. You
Mm.
can find out more information, because I too still hear that midwifery-led practice is the gold standard. It's the way to go. But that wasn't my experience. It was horrific. Other women who have had, and it depends where you go as well. If you
Yes.
go on a Facebook page that's pro Caesar, they will, generally the women there will talk about their failed VBAC and they wish they never
Yes.
did it. So I just think it's nice for women to have all of it in front of them, the good, the bad, the ugly, the in between, to then say, okay, this is what it looks like for that woman, that woman, that woman, and that one. What picture do I aim for me,
Mm.
right? And then if that doesn't work, what comes next? And then next.
Yeah, I think that's so important. And I know when I used to teach childbirth education, I was given a deck of slides and told, this is the curriculum, don't deviate, stick to
Ooh.
the, yeah. And cesarean birth was like, we don't talk about that, if you have to have one more, there was no cesarean classes and no statistics. Like, I think that's another reason why I wrote the book. There's preparation. in there as well, preparation for
Okay.
cesarean and
Oh, great.
gifts and packing your bag and things like that, because it's too late. I mean, I think about 50% of cesareans are emergency cesareans and the rest are
Oh,
elective.
okay.
But it's sort of, yeah, and they really struggle. The emergencies really struggle because they have not been prepared for it.
There's a lot going
Um,
on. Yeah.
and in terms of the anaesthetic, like in the UK, the guidelines say that 5%, up to 5% is acceptable for women to feel the surgery. And of those 5%, 1% will need a conversion to a general anaesthetic, which
Okay.
I mean, so we can say, look, a very small percentage will
Mm,
feel it.
yeah.
That's elective cesareans, but it rises to 15 to 20% for emergencies.
Emergency. Is that
So
because they're in a rush for the baby, I take
in a
it?
rush, and
Mm.
yeah, it's just so that's really important for women to know, and that they may need to debrief down the track after the birth, and they
Yes.
may need trauma therapy. So I think that, we have to be honest. We have to say, look, it's rare, but it can happen, and you have the power to demand, or you have the right to demand
Yes.
a general anaesthetic, because no one should be in that position feeling powerless and, dehumanized really by being,
Yeah.
you know,
Totally. I have a question on that actually because it came up before when I was like, oh, I've got too many questions. You've got so much valuable information to share. Is that so? Would a woman have the choice then if it's decided that cesarean is happening and it's actually happening, and then they can start to feel it? You didn't have a choice, you had to endure it. Would women have the choice to say, I want a general anesthetic? Like, how would they know that they need to ask for it? And the second part to that question is, what if they wanted to stay awake because the societal pressures, like, oh, you have to have the skin to skin with the baby, and it's all about seeing your baby for the first time? What are your thoughts on that?
well, look, I was awake for 4, 5 of the babies, and that was really great. Although I don't have any memory of seeing the 5th one.
Okay.
In theatre, I've got no memory of that, but once I got back to the ward, I've got photos introducing him to his siblings,
Okay.
and that I'd had pain relief by then.
Yeah.
So it was okay.
Yeah, so basically with when you could feel it all happening, you had no memory anyway. So if women can feel it, a general anesthetic is not necessarily going to take away that first connection, that first moment with your baby, is it? Or I don't know, is it?
No. Well, the thing is, there's a midwife there to receive the baby. And
Okay.
if you do have to have a general, you could organise with the midwife to make sure the baby has contact with your face before
Okay.
it goes, and then it'll go to dad anyway. But
Yeah.
yeah, it's the conversation beforehand. It's not with the
Mm.
obstetrician necessarily, it's with the anaesthetist. And
Okay.
he needs to assure you that if you're feeling it, he will take action. And that action might be to increase the
Flow.
spinal,
Yeah.
or if that fails, then you will authorize him to give you a general, and because the risk of pushing through and the aftermath, I
Yes.
mean, I've really lived with a lot of the aftermath for 34 years. And,
Yeah.
there's been times when I've been triggered, things that have triggered me into, and have 3 or 4 days of really bad times because
No
it's
one
just
wants
so
that.
close.
Yeah, no one wants that. Definitely not.
Yeah,
That's
so that's your choice, risk
yeah.
it and have a really tumultuous recovery, or be asleep and, see the baby pretty soon after, and know the baby's with the partner, the father or
The
the
birthing
birth
partner, yeah.
partner.
Yeah.
Mm.
And look, I think that happens a lot anyway. I know my daughter was taken away from me because they had extensive stitching to do, and
Yes.
she went with my partner because that was the next skin to skin contact with the family person. So I
Yeah.
think, yeah, the baby's not going to think, "Oh my gosh, where is my family?" And I think that's probably part of the fear that gets driven into us
Yeah.
to say, well, if you have a vaginal birth and you get baby on your chest, I didn't.
Mm.
I actually refer to my episiotomy as a vaginal cesarean,
Mm.
cut from front to back,
Oh.
all the complications that came with not healing, and then obviously the pelvic floor damage.
Mm.
So it's quite funny when you were saying before not having the vaginal experience. I was thinking, wow, I remember wishing I had a cesarean and didn't have that last push. Like, right?
Yeah. I
It's
don't know. The grass is always greener.
right. Yes,
Yeah.
agreed. But in actual fact, and I know this might be a bit icky for some people to hear this, but had you and I not had the experience and the trauma that we did, we wouldn't be here right now living a very fulfilling life by helping other women,
Mhm.
right?
Absolutely.
And having these type of conversations so that this doesn't happen to our daughters, so that they don't feel blindsided. I've never felt more fulfilled in my life to
Mhm.
know that we're helping other women. Would you agree?
Oh, absolutely. And when I finished the book, I remember thinking, wow, this is a gift for women, approaching cesarean birth or after cesarean birth. And then I realized it was actually a gift for myself. And that was amazing because it led me to seeking out birth trauma therapy 30 years after the event.
Yeah.
And it's a 3-step process, this therapy, the Richards therapy process. Absolutely amazing. I cannot believe the difference in my mindset since I've been through that process. And I thought, wow, I wonder what my life would have been like if I have had access to this therapy much
Earlier.
earlier. Mm.
Right. And I love that you just went there because I know so many of our listeners who have been through birth trauma, who have adult children just like you, still are carrying it, are
Mm.
still, even physically with their prolapse, but mentally and emotionally, it's still there. Even if they feel like, oh, well, I've lived with it for this long. What would be your last parting words to any of our listeners who in that situation now that you've gone through this therapy?
Oh, it would be just really find someone to debrief with, and there's checklists, the Woolly scale. There's different tools to measure the effect that the birth has had on you. And
Mm.
if you realize that you are living with long-term trauma, then seek out help. And I couldn't speak more highly of the TRPT therapy and therapists all over Australia, and Judith Richards, who's the author of the program, who's a survivor herself. She runs regular trainings and a lot of GPs are referring to her now. So yeah, I would just say, you know, especially before, if you're having another pregnancy, to
Mm.
get onto it, because you carry all of that baggage into the next pregnancy, and the fear and the distrust,
Yes.
that just doesn't leave. It's an unconscious, because as Judith Richards says, we only operate on 5% of our conscious mind, and the rest, 95%, is unconscious. And I realize how much of my behavior over the 34 years has been unconscious behavior from that trauma and
Ooh,
betrayal
that's very
from
powerful.
trusted people. Yeah.
That's really powerful. Wow. Wow. Go you, Leonie. I can't thank you enough for coming and sharing your wisdom, your heart, and your knowledge with us today. I will definitely put a link in the show notes to your website where people can find everything that they need to. And I would definitely recommend for anyone to share this. If you know someone's having a cesarean section, just have a conversation with them. Share this episode with them, and even as a midwife, I think you should have a listen. And then just leave it at that.
Absolutely.
Well, thanks, Leonie. Let's keep talking. Every
All right.
365 days, right?
Yes, absolutely.
Go you. Thanks, Leonie. Bye. I think it's really easy to see why we invited Leonie onto the show. Her years of experience, her personal lived experience, now writing a book and creating The Splint. She really is the expert when it comes to cesarean section. Now, if you are listening to this right now and you have personally had a cesarean section birth and the experience wasn't as you thought it would be, Leonie also has a free private Facebook group which you can join and be part of that community to share your thoughts and feelings. And I'm going to encourage you to do this. If you are a doula or a midwife who listens to this show, I encourage you to share this episode in particular with any one of your mamas who you think could really benefit from listening or who would just like to know more about cesarean section birth. I know the point of view that you don't want to scare women, but I want to reassure you that yes, Leonie's story at the time was traumatic for her and it took her a long time to work through that. But I promise you, by not sharing information with women who are seeking it and looking for it, we are giving them a disservice because they're going to be scared anyway. If we think by hiding away and keeping it quiet and not letting anyone speak about anything that can go unplanned during childbirth, like the cesarean section without the aesthetic, the forceps, all of the things that we don't talk about, women are going to be scared anyway. You're not going to stop them from feeling the fear by keeping it a secret. We need to be empowering women to have a voice, to be able to use the voice. But if we don't tell them that this can happen, they totally feel blindsided. We need to stop that and start having the conversations to not instill fear and make women think that their birth is going to go wrong, but just to give them the information of when or if it does happen. I know it's an opinion that might not be popular. And if you have a different thought or feeling about that, share it with us. We're open to hearing everyone's thoughts and feelings on this. I have put a link in the show notes for Leonie's website where you can check out her book, her splint, and the free Facebook group. So until next time, bye for now. Chances are, if you can still hear my voice, you are a dedicated podcast listener. And I would like to bet that maybe one day you'd like to start your own podcast too. Today's episode was brought to us by our podcast partner at Podbean. They are home to over 600,000 podcasts, and Podbean is your one-stop shop for everything that you need to start your own podcast. So whether you're in a studio, just like me, or you're on the go, the Podbean tools allow you to record, upload, and promote your podcast in a matter of minutes. You can download the free Podbean app and get started today. And if you use the code BRAVEMUM30, you can also get your first 30 days of podcast hosting for free. So why not give it a go?